Broccoli can truly help prevent stroke and protect your memory, but only if you eat it the right way. The concern is that if you're middle-aged or older, the way you're currently preparing and using broccoli may be quietly damaging exactly what you're trying to preserve: your blood vessel health, memory function, and even the effectiveness of your heart medications. In this video, I'll reveal the 3 most common mistakes people make when eating broccoli, especially dangerous for those taking stroke prevention drugs, living with diabetes, or at risk of heart attack. Mistake number 2 is something many people on blood thinners are making without even realizing it. Mistake 1: pairing broccoli with vinegar or lemon. Healthy? Not quite. Imagine a healthy meal that many people still make: steamed broccoli topped with a little balsamic vinegar or tossed into a salad with lemon juice for extra flavor. It looks fresh, clean, and nutritious, right? But here's the truth: most people don't realize that healthy combination may be destroying the core benefits broccoli was meant to deliver. Very few people know this, but broccoli is actually one of the richest natural sources of vitamin C. In fact, 100 grams of steamed broccoli can contain nearly twice the amount of vitamin C found in an average orange. And vitamin C isn't just about boosting your immune system. It's one of the most powerful defenders of arterial health, fighting inflammation, the hidden root of stroke, heart attack, and age-related memory decline. But here's the problem: vitamin C is fragile, and it's easily destroyed in acidic environments. Guess what vinegar and lemon are? Acidic. So when you pour vinegar over broccoli or toss it in citrus-heavy dressings, you're not just adding flavor, you're breaking down most of the vitamin C within minutes. This means you're eating broccoli, but your body isn't getting the benefit you think it is. And it doesn't stop there. Acid also interferes with iron absorption, especially non-heme iron, which is found in plant-based foods like broccoli. That's particularly critical for seniors and middle-aged adults who are at higher risk of anemia, poor cerebral circulation, or even chronic fatigue after meals. And yes, these are the very people who are often told to eat more broccoli for better health. Here's the irony: they're eating the right food, but the wrong way. Now, does that mean you should stop eating broccoli altogether? Not at all. In fact, I want you to eat more of it, but in a way that turns broccoli into what it should be: a natural medicine for your heart, your brain, and your long-term wellness. The simplest fix? Skip the vinegar and lemon. Instead, try adding a bit of pure mustard or horseradish. They're rich in myrosinase, a natural enzyme that activates sulforaphane, one of broccoli's most powerful compounds. Sulforaphane is known for its role in reducing inflammation, fighting cancer, and protecting brain cells from age-related decline. A study from Johns Hopkins University found that combining broccoli with foods high in myrosinase can double your absorption of sulforaphane, dramatically increasing the protective benefits for your heart and cognitive health. However, if you're living with diabetes and eating broccoli the wrong way, you could be putting yourself in a much more dangerous situation without realizing it. Symptoms like low blood sugar, dizziness, fainting, and even loss of consciousness can happen after a meal you assumed was healthy. Mistake number 2: too much broccoli while on blood thinners. This is something most heart patients are never warned about soon enough. Broccoli, if eaten the wrong way, can actually interfere with the effectiveness of the very stroke prevention medications you rely on every day. I remember a patient of mine, an older woman, well into her 70s. She was extremely careful with her diet: no fried foods, no red meat, not even salt. And every single afternoon, like clockwork, she had a plate of steamed broccoli for lunch. Then one day, she was rushed to the ER with chest pain and numbness in her left arm. The diagnosis? A small clot formed in her coronary artery, nearly causing a heart attack. The cause? Her blood thinner medication had stopped working as intended. And the silent culprit? Was the vegetable she trusted most. Here's what most people don't realize: broccoli is high in vitamin K. Now, vitamin K isn't harmful. In fact, it plays a vital role in the body. But if you're taking anticoagulant medications like warfarin, aspirin, or Coumadin, vitamin K works directly against their intended effect. While your medication is trying to keep your blood from clotting, vitamin K encourages clotting naturally. So if you suddenly start eating large amounts of broccoli, your vitamin K levels spike, and your medication dose may no longer be strong enough to prevent a dangerous blood clot. And the scariest part? You won't feel a thing, not until that clot blocks a vessel in your brain or your heart. By then, it could be too late. Now, let me be clear. I'm not telling you to stop eating broccoli. The problem isn't the vegetable. It's how inconsistent and uncontrolled the intake can be. You don't have to avoid broccoli altogether. In fact, many doctors still encourage patients to eat it, but only if they eat it in consistent, stable amounts. If you're on blood thinners, what matters most isn't whether you eat broccoli, but whether you eat it regularly, at roughly the same amount each day. Because when your vitamin K intake is steady, your doctor can adjust your medication accordingly, and everything stays in balance. There's one more important tip. Don't eat broccoli right before or after taking your medication. Give it at least 2 hours apart to minimize any interaction and allow your meds to do their job effectively. Remember, your medication is there to protect you. So is broccoli. But if you have diabetes and eat broccoli the wrong way, you could end up in a much more dangerous situation. Fainting, low blood sugar, and even losing consciousness, all from a meal you thought was healthy. Mistake 3. Eating too much broccoli when you have diabetes. Let me share a real-life situation that I see far too often in my clinic. One of my patients, a woman in her early 60s, had type 2 diabetes. She was proactive. She cut out white rice, gave up sugar, took her medications on time, and loaded up her diet with vegetables, especially broccoli, which she believed was a superfood for diabetics. And in many ways, she was right. Broccoli does help regulate blood sugar. But what she didn't realize is that eating too much of it without proper balance can be dangerous. That day, she collapsed right in her kitchen. Her family panicked and called emergency services. The cause? A meal made up of nothing but broccoli. No carbs, no protein, no healthy fats. Just a plate of steamed broccoli, clean and light, she thought. But for someone taking blood sugar-lowering medication like metformin or insulin, that's a recipe for disaster. Why? Broccoli has an extremely low glycemic index, which is usually great. But it also contains sulforaphane, a compound shown in studies to enhance insulin sensitivity and stimulate protective enzymes in the body, both of which can further lower blood sugar. This is fantastic only when it's done in moderation and combined with the right foods. But when you replace your whole meal carbs, protein, and fats with a large amount of broccoli alone, you push your body into a state of hypoglycemia, dangerously low blood sugar. And unlike high blood sugar, hypoglycemia hits fast. You don't get a warning, just a wave of dizziness, your heart races, you break into a sweat, and suddenly you're on the floor. In younger people, the body can often recover, but in seniors, every hypoglycemic episode can chip away at brain function, heart strength, and memory. Now, let me be clear. I'm not telling you to stop eating broccoli. In fact, I absolutely encourage it because it can help stabilize blood sugar, but you have to eat it wisely. The fix is simple. Always pair your broccoli with a small serving of complex carbs and lean protein. For example, a bit of quinoa or half a cup of brown rice, a piece of grilled salmon or chicken breast, and your broccoli, steamed or lightly sautéed in olive oil. This kind of meal helps keep your blood sugar steady, sustain your energy, and prevent dangerous crashes. Because even the best superfoods, including broccoli, can't replace a balanced diet. And especially for those living with diabetes, stability always beats extremes. After everything you've just heard, you may be asking yourself, how do I eat broccoli the right way? I don't want to give it up, but I also don't want to hurt myself unknowingly. So, can you still enjoy broccoli safely and make it work for your heart and brain? Absolutely. You don't need to cut it out. You just need to pair it smartly. Here are 3 proven combinations backed by science and used in my own family's meals. Broccoli with oranges or tangerines. One reason many people feel tired, dizzy, or mentally foggy even after eating broccoli is that plant-based iron is poorly absorbed without help. That's where vitamin C from oranges, tangerines, or citrus juice comes in. When paired with broccoli, it enhances iron absorption, helping the body create healthier red blood cells, improving blood flow to the brain, and reducing the risk of cerebral fatigue and anemia-related memory issues. Try this simple approach: a fresh salad with steamed broccoli and orange slices, or a light smoothie with broccoli and tangerine juice. It's refreshing, delicious, and a natural boost for your brain and heart health. And speaking of circulation, is there a way broccoli can help lower your blood pressure naturally? Broccoli with onions. Onions aren't just flavor enhancers. They're rich in quercetin, a powerful flavonoid that fights inflammation, protects blood vessels, and supports healthy blood pressure. Combined with broccoli already loaded with sulforaphane, they create a powerful anti-inflammatory combo that helps clean out your arteries and lower the risk of stroke, arterial plaque, and hypertension. One of my favorite ways to prepare this: lightly sauté broccoli with red onions in a bit of olive oil. Add garlic or turmeric to further enhance anti-inflammatory effects. This dish is ideal for older adults, easy to digest, and incredibly helpful for post-meal blood pressure stability. But the last combination is a little-known secret, especially valuable for older men: broccoli with tomatoes. Few people know this. When you pair broccoli with tomatoes, you're creating one of nature's most powerful cancer-fighting meals. Tomatoes contain lycopene, an antioxidant proven to reduce the risk of prostate cancer, protect nerve cells, and enhance cognitive function. And here's the kicker: lycopene is fat-soluble, which means it needs a bit of fat to be absorbed. So when you sauté broccoli and tomatoes in olive oil, you improve lycopene absorption and boost the uptake of vitamin K and beta-carotene from broccoli. This is a dish I often recommend to men over 50 at least 2 to 3 times a week to help prevent cancer, support memory, and strengthen cardiovascular health. As you can see, broccoli isn't the problem. On the contrary, it's one of nature's best gifts for your heart and brain. But just like any powerful natural medicine, it only works if you use it the right way. If you found what I shared today helpful, hit the like button so YouTube knows that heart health and memory really matter to people. Don't forget to subscribe so I can keep bringing you simple, easy-to-understand medical insights that can truly save lives. And if you have a loved one who's taking heart medication, living with diabetes, or starting to show signs of memory loss, don't keep this video to yourself. Share it, because sometimes just one right meal can prevent a stroke. Thank you for watching all the way to the end. I'll see you in the next video, where we'll keep learning how to better understand our bodies and take charge of our health each day.